Hey, and no one can worship you for me, because I think back about all the things you've done for me, and no one can worship you for me. Here's my worship, here's my worship, all of it, all of my worship. I lay it at your feet, God. Receive my worship, God. All of my worship. I'm not only the bread, here's my worship. You alone are exalted above the earth, and the earth is filled with the glory of the Lord, and the earth is filled with the glory of the Lord. And all flesh shall confess you are God, and all flesh shall confess you are God. Yes, repent. Here's my worship, and I will never be silent. Yes, my worship. Here's my worship. Here's my worship. And I declare, I will not be silent, and I will always worship you. As long as I am breathing, and I will always worship you. I will never be silent. Yes, I will. Yes, I will not be silent. And I will always worship. I will come without fear. I will come without fear. I will come without fear. I don't care what they say. I don't care what they see me. I am free. As long as there is breath in my somebody declare, I will not, I can never be. No, 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 I will always worship you. As long as I am breathing, I will always worship you. You deserve it. You deserve it. Yes, you do, God. Yes, you do, God, deserve it. Yes, Abba, you deserve it. Somebody declare, my hallelujah, my hallelujah belongs to you. Let your heart cry, let your heart cry, let your heart cry. Belongs to you. I give it to no one else. I give it to no one else. My hallelujah, my hallelujah to you. I give it to no one else. I give it to no one else but you. My hallelujah, it belongs to you. Take it up. You deserve it. You deserve it. Yes, you do, God. You deserve it. All of my worship, God. Hallelujah. Hosanna, 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 Hosanna to the Lord. Oh, and you're worthy, you're worthy, you're worthy, you're worthy, you're worthy, you're worthy of our praise. We'll lift our hands and we'll sing Hosanna, 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 Hosanna.
Is higher than cancer, is higher than heartbreak, is higher than any disease. Just speak in tongues if you know how to speak in tongues. Salabando koba shata baba keseboska retebogobos rema baba shata bagozo tokoya ha 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 rotobobobo shata bahaya. Get ready to be blessed. Higher than another name. Wave your hands glory, all sing praise. In him we are saved. The name of Jesus, higher than other names. King of all kings, no other name like his. The name of Jesus, higher than other names. Alpha and Omega, no other name. If you believe that, wave your hands to Jesus. Hey, 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 hey. Hey. Your name like sweet perfume, poured upon my soul. Yeah. In your name we overcome. In his name there's victory. His name is powerful. The name of Jesus, higher than other names. King of all kings, no other name like his. The name of Jesus, Alpha and Omega, no other name. Lift your hands, tell the name of Jesus. King of all kings, no other name. The name of Jesus. Alpha and Omega. Alpha and Omega. Come on. Hey, hey, come on. Hey. Every other God, you're better than dead. Jesus died and rose again. Lift your hands, let's listen. We lift him higher. In your name, every knee shall bow. In your name, then I say, oh, we call upon the name. Call his name. Jesus. Call that name.
Okay. Hello, good afternoon. Welcome to another edition of Footstep Show. If you have just joined us, we are live on Facebook and on YouTube, the Footstep Show. So just join us, share the page with your friend, and tell them about what we're going to do. Today we are discussing dealing with depression and anxiety in the face of COVID-19. And I believe that we are all going through so many diverse challenges in our life. And I believe that there are some signs that maybe we know, but we have not really taken notice of it. Maybe are you someone who normally have sweats hands, or even have lost interest in having sex, or sometimes you have rapid headache. Well, these are some of the topics that we'll be discussing about this. So on behalf of the whole team, we welcome you to another edition. Stay tuned. We'll be right back just after the motivational quote.
Hi, good afternoon, everybody. Welcome to the quote of today, which is struggle. You don't have to struggle in silence. You can be unsilent. You can live well with a mental health condition as long as you open up to somebody about it, by Demi Lovato. So when I went through this quote, I was like, wow, this is powerful, because I was able to relate myself with it in terms of what we're going through right now in this pandemic. You know, like a lot of people are going through a lot. They are depressed. They feel like they have some level of anxiety in themselves, and they keep it from themselves. and they don't want to open up to somebody because they'll feel that they'll be making fun of. They'll tell the people might insult them to say, look, what are you trying to say? Like, but it's really important to always discuss about what you're going through to someone you trust, because maybe that person can be the key to your answer. You never know in life. So it's always important. I know this pandemic has been a struggle for all of us, but it's always important to open ourselves to others, to our friends, to our mother, our dad, anybody in the family that we know that we can talk to, because you never know, maybe that same person is going the same way as you're going through today because of this pandemic or any other day. So this is my motivational quote for today. Enjoy the rest of the show.
Well, welcome back from the motivational quote. Today we are discussing dealing with anxiety and depression in the face of COVID-19 pandemic. And my guest today is Dr. Joe Deborah, a youthful person who will be helping us. She's speaking to us all the way from Atlanta. So welcome, Dr. Joe Deborah. How are you doing, sir?
Thank you very much, Brother Daniel. I'm doing very well. How about yourself?
That is good. Oh, very good. I'm doing very good. I'm doing very good. Yeah. So, first of all, who is Dr. Joe Deborah? If you can tell us a little bit about yourself, and then we will dive into the discussion.
Yes. Briefly, I am a Ghanaian-born, American-trained family physician. I currently am doing my residency in upstate New York, and I am very passionate about educating the public. I am a devout Christian, and the Bible makes it very clear for us the power of knowledge if we devote ourselves to it. And I am a firm believer in the fact that what you don't know can actually hurt you. I know many people say if you don't know something, it cannot hurt you, but I've lived a little bit to know that that is actually a myth. And so I pride myself in dedicating myself to the work of God, to my career, to my calling in life, and bringing information to people to educate them whenever I get the opportunity. So I am very humbled by this opportunity, and I thank you for inviting me to come do this.
Thank you so much. We are also happy to really have you on the show. So first of all, let's look at what is anxiety and what are some of the signs of anxiety.
Certainly. I first of all, before we even dive into this topic, I want to say a little bit about why I think this is a very timely topic that you have picked. And it ties in directly with the motivational quote that our sister just read for us, because the truth is there are so many myths and many misconceptions in the public about anxiety, and the once in a lifetime pandemic that we just went through certainly did kind of make this a more pressing topic for most providers or most clinicians. So before I even tell you what anxiety actually is, I will tell you what anxiety is actually not, because there are so many myths, like I mentioned. So first of all, there is a myth out there that many people say anxiety is actually not even a real disorder. Some people say, oh, anxiety happens to people who just cannot handle stress, or it causes people to faint. And if you suffer from anxiety, you don't necessarily need professional help. All these things are actually not true, because anxiety and with its associated panic disorder are all actually both mental and physiologic disorders. So if you don't get anything out of today's conversation, one thing that I want you to leave here with is that anxiety and depression, we will talk about later, are mental and physiologic disorders. You have neurochemical imbalances in your brain that can contribute to this. Is this the only reason why people have anxiety? Certainly not. But it has a very prominent physiologic component to it. And so I want people to know that anxiety is a disease that the hallmark of it is mainly excessive worrying out of control, worrying to the extent where it becomes debilitating. And this can happen once, it can happen multiple times. If it happens multiple times, then definitely we're talking about a panic disorder. When it happens one time, then we're talking about a panic attack. Now, as long as these things interfere with your daily life, then certainly it's something that needs to be addressed. So I wanted to make sure I make that as clear as possible. Now, you also asked me what are some signs or what are some symptoms of anxiety. So based on the definition that I just gave, that it is not just related to fear or excessive worrying, but it has a physiologic neurochemical component to it that actually plays into how anxiety exhibits itself. Some people will have excessive amount of fear of an impending doom, that something really bad is going to happen to them. Some people do have what we call palpitations. They feel like their heart is racing out of their chest. In several circumstances, patients have actually said, I felt like my heart was going to come out of my chest. People have excessive sweating. People have what we call diaphoresis, where they start sweating profusely, they become very tremulous, they start shaking uncontrollably. But it also has some GI components to it. So some people experience nausea, some people have vomiting, some people have dizziness. So these are all some of the very simple signs that once you see will kind of prompt you to the direction of maybe you have an anxiety attack or a panic attack.
Wow. So that means that, I mean, there are so many signs that we go through them day to day that are some of the symptoms for this. So can we also look at what a depression and also its symptoms in depression?
Certainly.
So
we certainly can talk about them both at the same time, because they kind of go hand, mostly they co-current. The research shows that many patients who actually have anxiety seldom have just anxiety disorder. There is usually either another psychiatric disorder on board, or there is an associated depression and things like that. So just like we did for anxiety, let's talk about what depression is not. And even more so for depression than anxiety, I think it's actually the misconceptions and the myths out there are more deadly and more concerning for even that of depression than anxiety. So, being someone who was raised in Africa, Ghana, West Africa to be precise, you hear this a lot that, oh, depression is just people not knowing how to control their emotions, or depression is a disease that affects people who are lazy, or depression is something that people can snap out of it right away, or there has to be a reason for someone to be depressed. And by your reaction, I can certainly say that you probably have heard some of these things before.
Yeah, a lot of them.
Some people also say, oh, depression, every woman who goes through childbirth will have depression. So these are all misconceptions. These are actually not true. Yes, there is a component of depression being more predominant in female sex and things of that nature, but it's not necessarily true. So depression itself is just like its counterpart, anxiety. Whenever you go to your doctor, they are looking for some things that will point them towards a major depressive episode. So two major questions that we usually ask is, have you noticed that you've lost interest in something that you really were interested in the past, something that really used to give you fulfillment, excitement, and you find yourself that you are completely out of that? We call that, scientifically, we call it anhedonia, inability to feel pleasure. So something that used to give you pleasure, you find yourself over a period of 2 weeks not feeling that anymore. That usually is very concerning. The other question that we usually ask, and I'm pretty sure your doctor may have asked you in the past, is, do you feel depressed? How is your mood? Those are two specific questions that we ask to kind of give us an idea what we have to be on the lookout for. So depending on the answers you give to these two questions, if you give a positive answer for one of them, this by the way is what we call the patient health questionnaire 2, because it has two questions. So if you answer yes for either one of these, then we have a more extensive assessment which will ask you for more of the symptoms of depression, which we call PHQ 9 or Patient Health Questionnaire 9. You can find that in the DSM-5, which is the Diagnostic and Statistic Manual for Mental Health Disorders, the 5th edition. So PHQ 9 will go through most of the bread and butter depression symptoms that we actually are more accustomed to, which is lack of energy, lack of interest, excessive fatigue, decreased inability of sleep. So there is a very systematic way we go about it. Feeling guilty, sensation of feeling guilty without something really happening to you or being attributed to a specific thing. That certainly is also part of the whole depression assessment. And then appetite. Some people have increased appetite, some people have decreased appetite. Some people sleep more when they are depressed, some people sleep less when they are depressed. And then some psychomotor agitations, such as you being on edge the entire time, which ties into a little bit of anxiety. So there is a spectrum of things that we look for when we talk about depression and anxiety, as I have tried to kind of narrow it down as far as the symptoms are.
I think you really said a lot. But before we go to some of the causes and how do we really prevent it, I want us to take a break, and then when we come back, we deal with this other questions. So we'll be right back just after the break.
Sounds good.
Thank you. All right, welcome back. Well, if you have just joined us, today we are discussing anxiety, dealing with anxiety and depression in the face of COVID-19 pandemic. My guest today is Dr. Joe Deborah, who is helping us to discuss this topic. Well, if you have any comments or any questions or anything that you want to really ask, please just share with us on Facebook, YouTube, and also there are other people all the way at Newark, New Jersey, Ghana, Emmanuel, who are joining us on Zoom. If you have any questions, you can also post your questions there, and Dr. Deborah will answer your questions for us. So before we went on break, we were talking about it. So can we look at the causes of these symptoms? What really caused them, and what do we have to do on the lookout when a family member is going through those symptoms?
Sounds good. So, yeah, certainly when we talk about anxiety, you did make a very interesting point earlier, saying that, oh, these are like symptoms that I have, or these are symptoms that I see. These are daily things that happen to all of us. So finding the causes, or how do we distinguish these symptoms from a daily life activity or a routine occurrence in your life, as opposed to something that you need to be talking to your doctor about, or you need to be seeking help for. And the key word I want to remind our audience from the definition or the description I gave of both anxiety and depression. Anxiety specifically is when these symptoms become debilitating. It's when these symptoms start interfering with your daily life. So having some form of fear, I always say there is a healthy amount of fear that occurs in any student's life, or that should occur whenever you are about to take an exam. But when it gets to a point where you are unable to sit for that exam, then it becomes something that needs to be addressed. So I just wanted to make sure our audience are very clear on that. So the question on hand now, the causes of anxiety, is actually one that is very, very intriguing, because part of the myth out there, which I alluded to earlier, was people think that there has to be a trigger for anxiety, which is not necessarily true. As a matter of fact, when you check the American Academy of Family Physicians, their documentation on generalized anxiety disorder or panic disorders and things like that, it is actually very often that we don't see, or we don't find an actual trigger for the anxiety. We don't see something directly causing it. Yes, certainly trauma does play a role in one developing anxiety, but like I said earlier, sometimes these are just neurologic imbalances in your chemicals, whether serotonin and things of that nature. Also, if there is a family history of anxiety disorder or depression, those are certainly things that kind of raises our level of suspicion for someone to develop anxiety. In the same breath, when you talk about depression, most of the time people will say, oh, this happened and then I started getting depressed since then, which is great if you are able to remember what actually happened and things like that. But most patients who suffer from major depressive disorder don't actually recall what happened. All they know is these symptoms just started. And so some things to look out for, risk factors, I would say, is certainly if you have someone who at baseline has a low self-esteem, that is certainly concerning. And then also I did mention that depression is more common in females than in males. So if you are a female sex, that is certainly something you need to look out for. Either anxiety or depression, if someone goes through a major life-changing event, that can also trigger anxiety and depression. So these are some of the basic things that we need to keep an eye on. If you have been treated for depression in the past, let's say when you were younger, you were treated for depression or any other psychiatric disorder, there is a propensity or there is an increased risk of you developing anxiety or depression, because they are also neurologic disorders or mental health disorders, I should say. So certainly these are some of the things that you need to look out for. Like I said, adverse life event, losing a loved one. Many a times you will run into someone and they will say, oh, things have not been the same since my loved one died. That is certainly a red flag. So the second part of your question, I would say, what are some?
Look at the second part of it. Before
Sure.
you talk about the second part of it, just a follow-up question there. That you said that someone lose. Somebody is sending me a question asking me that, what if the person really have lost interest in even having sex? Is there a medication or something like that, or are we can talk about some medications that people have to really take it, or what must the person really do?
A very good question.
Look at the other parts and then we address those issues, or we can take the questions now.
Yeah, so we will certainly talk about treatment of these things. I will certainly talk about how these disorders are managed. So we will certainly address that question. But as far as the person, the question that, let's give for instance, someone has lost interest in sex completely. So the reason why mental health disorders become very difficult to kind of manage or for people to even talk about is there are so many other medical conditions that can mimic these things. So when you take someone with anxiety, for instance, one of the first things we check when you come in with those symptoms that will make you think that you have an anxiety disorder is to check your thyroid levels, to do an endocrine panel to see, because having thyroid abnormalities will mimic this like exactly the same way. So there is like a systematic approach that we take before someone is actually given that diagnosis of anxiety disorder or major depressive disorder. So there is certainly the question of, okay, how long has this been going on? When did you notice this change? And then there are other physiologic responses that we look for or we ask. So if someone has lost interest in sex, are they still having early morning erections? Because it's very physiological, very common for men to wake up and then they have an erection without any sexual stimulation. If you still have that, that is also something that we need to consider or we need to talk about. Or is there a conflict in the home? Because research shows that when there is a conflict between a man and his partner, then there is also the risk of causing psychogenic erectile dysfunction. So there are so many things that can mimic that. There has to be a constellation of symptoms that we need to actually sit down, talk about, and then be able to say, okay, based on this, based on some labs that we have, based on what you are telling us, based on what our clinical assessment is. And one very important clinical tool is the physical exam that your doctor will actually perform on you. Based on that exam, your doctor is able to say, okay, this seems more to me like a depression associated erectile dysfunction as opposed to a medical associated or due to an underlying medical condition. And so when that happens, then we can talk about treatment, management, and those things of that nature. So if you don't mind, I can go into the treatment or management of these disorders, and then
if you can finish with the causes of the anxieties, and then maybe
sure, certainly
the treatment level. Yeah.
Certainly. Yeah, so as we were talking about, the causes of anxiety or depression, like I said, has the symptoms does overlap with a lot of other medical conditions. So we have what we call pheochromocytoma, which is an endocrine disorder. We have hypothyroidism. Those are also endocrine disorders. You have someone who has an underlying heart problem. So their heart at baseline has what we call an arrhythmia, an irregular heartbeat. When that happens, that can feel like someone is having an anxiety attack. People with another heart disease or a heart condition called atrial fibrillation, that also mimics anxiety disorder. So there are so many other things. People who suffer from epilepsy at the baseline, they can present with symptoms of anxiety disorder. So the specific causes of anxiety disorder is certainly something that is very broad. But the other common causes that we see, aside from the psychogenic and the medical aspect, is things like caffeine, energy drinks, taking albuterol inhaler, or even nasal congestants, and substance use like cocaine, Adderall. These are all things that, not surprisingly, can also cause anxiety disorder. And then the other part is if someone has a substance use disorder, they use either any illicit drug, any of the street drugs. If they are withdrawing from those medications or those drugs, they can also develop anxiety disorder. So those are some of the general causes of anxiety that I can, off the top of my head, kind of bring up.
So haven't we dealt with the causes of it? So can we also look at the treatment level? The treatment with anxieties and depressions, and we also want to remind those watching us right now is that we are dealing with depression and anxiety in the face of COVID-19. Please do share your questions and your comments with us, and anything that you want us to really talk about it, or any questions you have, please let us have it. And you might not know, maybe your family member, a friend, or a colleague is going through depression and anxiety, that you can really address certain things. So can we look at the treatment level for depression and COVID-19?
Certainly. So before we even talk about the treatment, there is a stratification that I need to make our audience very clear about, that these symptoms are not present in everybody with depression or with anxiety. So if your grandfather, let's say, has depression and exhibit some specific symptoms, it doesn't necessarily mean that you have to have those exact symptoms to actually have anxiety or depression. And so I want to make sure that our audience are clear on that point. And then as far as treatment is concerned, there are various strategies that we use when it comes to treating anxiety. So once you've sat down with your doctor, you've been diagnosed with a major depressive disorder or an anxiety disorder, then the question becomes, what way can we most optimize your health? I fancy personally in my practice coming up with a patient-centered care. So I usually will ask my patient, I say, how do you think we can get control of this? And then people will talk about everything that they have concerns about. So there is certainly medications that we prescribe for anxiety or depression. We talk about SSRI, which is serotonin reuptake inhibitors, which is the recommended medications that is out there for it. But research shows that doing just medication for anyone with either of these disorders doesn't actually have the full benefit. So when it comes to patient-centered care, then you and your doctor have to talk about things like exercising. Education is very important, because what if you study your patient with an anxiety disorder on a medication and the patient is somebody who drinks 10 bottles or 5 bottles of energy drinks a day. Those are things that you and your patient, you and your doctor have to discuss, so they can take you off some of these energy drinks or these stimulants or caffeine. Also, there is a major role for exercise when it comes to treatment of these mental health disorders. And the reasoning, believe it or not, could be very simple as if you find yourself exercising more, you feel good about yourself. And once you start feeling good about yourself, you are more likely to comply or be compliant with your doctor's recommendation about taking medication. You are more likely to have a better sleep because your muscles are tired, they need to relax. You are more likely to eat more healthy because you are focused on exercising and getting your body in shape. So there's what we call therapy or cognitive behavioral therapy, which plays a major role in the treatment of anxiety and depression disorders. And those are there are a host of other medications, but medications certainly, but you cannot overlook the component or the point of exercising, being well educated, talking to your doctor about it, asking questions, being in touch with your therapist if you have one, or reaching out to somebody that you could trust, like Brother Daniel said earlier during the cast, that you can reach out to someone and then they will be able to kind of help you. And also sometimes there are groups that are available where people who have, let's say, anxiety disorders, they meet together. Now everything is online thanks to the pandemic, so they meet virtually. There is a lot of groups around, because you will be surprised to find that the more you talk about your underlying disorders or things that are bothering you, your feelings, your sensations, the more you are able to actually get better from those conditions.
All right, so a question is, can I lose my life if I'm going to depression? Can someone going to depression take off his life?
So thank you very much for that question. That is a huge component of depression, major depressive disorder. So many people go through depression and do not have suicidal ideation or suicidal intent. But research shows that a higher majority, I did have the percentage of it precisely somewhere, I can actually check and let you know the actual percentage of the number of patients, the number of people with depression who end up committing suicide. But since the topic of suicide have come up, I have to tie it into why I think this is an appropriate topic for this time. So in the midst of a pandemic, which doesn't happen much often, we usually will hear of an epidemic here and there, but in a global pandemic like what the COVID-19 disease has brought, there is a huge mental toll, not just for people suffering from depression or anxiety, but also the family or the support system that these people have. So there are people who previously would have been very stable with their anxiety or their depression because they get to go to church every so often. They go to church 2-3 times a week. They meet people, they are able to associate. But what the pandemic did was take away that support system. We don't have the data out yet, but my prelim judgment will be that the next suicidal data that we have for the year 2020 will certainly be high, because if you actually check the research data that we have released by CDC, you will notice that from 1999 up until 2018 or 2019, the rate of suicide has progressively increased. And so having a pandemic in the midst of a rising suicide rate actually is something that is very concerning. So we will be very, I for one, I'm very interested in seeing the data to be released on the suicide rates in the year 2020. But certainly whenever someone is depressed, you are running a very high risk of committing suicide. And so it is very imperative that you seek help. And that is why I actually wanted to do this, that if you don't seek help, the chances of you following through with any suicidal thoughts or ideations that you have is certainly something that is concerning for us. And also, as an aside, the suicide rate, even though these disorders are more common in females, the suicide rate is actually more common in men than women. So you can make of it what you think the reasoning is. Some speculate that because men feel like their masculinity has been stripped from them when they get depressed, and so they are more likely to commit suicide. Whatever the reasons might be, the data, there is evidence to show that men who are depressed actually do end up committing more suicide attempts and death from the depression than compared to their female counterparts. So that is a great question, but the short answer is certainly yes. You are at a very high risk of suicide whenever a depression is in play.
All right. So another question is someone said that I do have a depression right now, and I find it so difficult in sleeping. And the person is on pills that the doctor had really been giving, and those pills are not helping him or her. What must the person do?
That's also a very good question. So the first thing, or the most important thing, is this person actually has a provider who is caring for them, which is very important. So I want to commend that person for first of all seeking help and getting the help that they need. But if you realize that your pills are not working or your medications are not effective anymore, certainly that is an indication that it's time for you to sit down with your doctor, revisit the whole topic again, and let your doctor or your provider know that, oh, the medications, maybe they were working well in the beginning, but it's not working for me anymore. And certainly your provider will be more than happy to switch you to a different class of antidepressants, which you will most likely gain benefit from. And they can certainly talk with you about having a therapy or seeing a therapist who, when you combine these two things, the medication with the therapy, is very, very productive in addressing depressive symptoms. So I'll certainly say it's time for you to sit down with your doctor and have a discussion about switching your medications to a different class that you will gain benefit from.
Okay, so one more question that I do have is that a young guy is really saying that he's at school, but then he finds it so difficulty in concentrating whenever he picks book to really learn, and he's going through so many challenges. He finds it so difficult opening it up with people. What must such a person do? Is there any counselors or something, or do they have to really talk to someone they trust, or what?
Sounds good. For our listener who is going through this, I first of all want to say to you that thank you for bringing this up. I know it must be very difficult for you dealing with this and then having to share with us. But I certainly will recommend that you do reach out, not in the community, but to seek expert help. When I say expert help, is talk to your primary care doctor. If you don't have one, talk to a doctor that you go to get your physicals done with. Reach out to an expert and say, hey, these are the things that I've been feeling. I know I have a lot of stress, and I cannot belittle the stress that comes with education or learning or studying. It's one of the most stressful things that we can ever endeavor or venture to do. So sit down with your doctor and say, I've been having these symptoms. What can I do? And your doctor will certainly be able to guide you to resources. I know up here in upstate New York, we have what we call the Healthy Families Initiative program here, which is an organization that assists with families in various other aspects. And so if you are in the upstate New York area, you can certainly call the hotline and then they will be able to get you in touch with a therapist. The beautiful thing is, whenever you go to your doctor's office or your therapist's office, everything that you discuss with them, they are legally obliged to keep it between you themselves. So you don't run the risk of it coming out. And yes, even if you are underage, you can certainly seek mental health treatment without the approval of your parents if you feel those are things that you're going through. Yes, certainly at some point I would say the discussion will come up between you and your provider as to if it comes to initiating medications and things of that nature. But if you feel suicidal, for instance, there are suicide hotlines that I would strongly recommend you to Google wherever locality that you are in, and just pick up the suicide hotline. There is mobile mental health programs in other regions all across the US where you can call the mobile mental health region. You just have to Google it, mobile mental health in my region, and then you will get a number where you can call and talk to a mental health provider 24 hours, 7 days a week. So I would certainly say reach out to your doctor if you're comfortable doing that. If you feel you're uncomfortable bringing it up with your doctor right away, certainly Google any of these mental health options in your locality, and you will be able to get the help that you need, because it's imperative for your success in school that you get the help that you need.
Thank you so much. So I think there are more questions coming in, but can we take our final thought? How can we cope with depression? I know you've really dealt with it, but how can we cope with it in the midst of this virus of that we find ourselves in? How can friends
certainly
cope with?
I'm not surprised that more questions are coming in, because this is a very pertinent thing that we're talking about here. But certainly coping mechanisms are very pivotal. There is an African adage that says no man can exist on an island. I say that to say that coping mechanisms usually revolves around self-image and also the support system that we have in place. So when it comes to self-image, like we talked about, exercising is a very pivotal thing. If you have concerns about your self-appearance, your sexuality, and things of that nature, those are things that I will strongly recommend that you reach out to a provider or your provider and talk to them about it. But having a good self-image, having a good self-esteem actually goes a long way to help, because like we mentioned earlier, they are certainly risk factors. And then the other part is someone once asked me in the office, what can I do about my genetics? Unfortunately, there's not much you can do about your genetics. So if you have a genetic predisposition to being depressed, then taking care of the other things, your self-image, will certainly be something that will help you kind of avoid or be able to cope with this. And then support system, surrounding yourself with people who will be honest with you, will be truthful with you, and also who have some knowledge about what you are feeling. So support system can be people in your church. I know in the Ghanaian community, a lot of people use our pastors and our church leaders as our counselors, our motivationalists, everything. We reach out to them. So that is certainly a support system that is out there for you. And then the other part is support groups in the community. Wherever you are, you can just Google it or put in your zip code, and you will find support groups around you. And then being a part of these support groups will certainly be able to help you. But I can't emphasize enough, realize there is no shame in reaching out for help, and know that you are not going through it alone. You don't have to go through trauma to experience these things, but certainly if you feel you are having any of these symptoms that we've talked about, just reach out and then get some help.
All right, so I have one more question. No, I have three questions to really ask. One is really saying that what are some of the protective factors for depressions?
Yeah, so some of the protective factors for depression are what we talked about. I know there's a lot out there that talk about, oh, if you work hard enough, you're not going to be depressed. That's not true. When it comes to neurochemical imbalances, if your serotonin level is low, unfortunately, there's nothing that you can do unless you are given medication to actually bring your serotonin level up or prevent the breakdown of serotonin. If you have a genetic predisposition, there's not much you can do about that. But what you can do something about is engaging in the community, engaging in exercise, and building your self-image up. Making sure you stay in tune with your goals, not setting too far off reached goals. Some people set such an outrageous goal, and then before they realize that they are in so much trouble trying to reach that goal, and then that becomes an issue. So ways to prevent these from happening, unfortunately, there are no definite ways that you can say, okay, I'm doing this, so I'm not going to get depressed. Unfortunately, because of the combination of the neurochemical abnormalities with some other environmental issues, there is certainly not a definite way of avoiding it. You can do your best to be in shape, to be more around supportive people, but unfortunately, there's not one thing that you can do to avoid being depressed.
And the next question is that the person is basically saying that self-care helps doing something that will make you happy.
Correct.
Will help you,
which is building your self-esteem.
Yeah, but yeah. So another person is saying also her question is that she has really been in emotional stress out of a relationship, and he sometimes feel depressed. What must he do, or what must she do to really come out of this emotional stress that is in? And if she finds it difficult in reaching out to a doctor, telling them about it.
Certainly, and yes, I do certainly know that this can be very difficult for people to reach out to a provider. But for this specific question, for instance, knowing that this is, let's say, a breakup that is resulting in this, there is physiologic response that you have whenever you go through any breakup in any relationship. So as long as that is not to the level where it becomes debilitating, it starts interfering with your daily life, then those are things that we can certainly say that you can practice self-coping mechanisms and things of that nature. But if our listener has realized that the emotional stress or duress that she feels she's under is beginning to interfere with her daily life, then I would say it is certainly time to reach out and have a conversation with someone. Talking about how you are feeling and what has happened to you is very helpful. I cannot underestimate the power of having a dialogue about the trauma that we have gone through. So reaching out to someone that you trust, like I mentioned earlier, it could be your church pastor, it could be a leader or a mentor, it could be a counselor that you had in high school or college. Most of us had these people when we were growing up. You can certainly reach out to them, and I'm very sure they will not turn their back on you.
All right, so well, this is a follow-up question that I want to really ask. Is that when you were speaking, you made mention about patient help questionnaires. So can
Correct.
someone able to really examine his own self, or maybe he has a parents that they are going through this, and can you maybe tell us some questions that maybe they can do a self-check in their various homes?
Yes. So the patient health questionnaires are certainly a very useful tool when it comes to diagnosing depression or anxiety. But as I mentioned, there is a host of medical conditions that can mimic these things. So, yes, asking yourself, oh, am I actually feeling good? Do I feel tired? Has my sleep changed? Those are all symptoms that you will be able to ask yourself, or you are the one who will tell your provider. But there are clinical signs that your provider will be looking out for. Your provider will be looking at your affect. How is your affect? Is your affect high? Is it low? Are you swaying from topic to topic? Are you very tangential in your thoughts as you are talking with your provider? So there's a host of clinical assessment that actually goes in before you can be diagnosed with either depression or anxiety. But yes, the symptoms are certainly something that you can be on the lookout for, and you will be able to assess for yourself. But before you call your doctor and say, I have major depression, I would strongly recommend that you go to your doctor and let them do a clinical assessment and look for signs of depression, which we look for, because those will be able to help gear the way they go with your management. And then they will be able to do some labs and other tests, which, in addition with their physical exam, will tell them if this is likely due to some underlying condition or it's just a straight pure mental health disorder.
All right. So my final question, that someone is asking that I am depressed. Can I be tested that maybe I have a mental health issue? Because maybe the person question is that can he or she be tagged as a mental health, because when emotions are high, the way he or she behave can lead him to. So can we tag the person that I have mentally issues?
So I would say not quite yet. The reason why you don't want to tag yourself with a mental health disorders, because one, there is already a very negative stigma, which I am very happy that the American Psychiatric Association is working very diligently to change that stigma out there, that if someone has a psychiatric or a mental health disorder, they are quote unquote psycho. No, that is not the right word. That is a word that we are trying to kind of rid out of the vocabulary for mental health disorders. But as far as our listener is concerned, if you feel down or if you feel that your mood is depressed, then the question is, what other symptoms are you having? Once we go through all those symptoms, like I mentioned, your sleep, your appetite, your energy, your psychomotor function, your concentration, and once we go through all those things, then the question becomes, what other clinical signs are you having before we can even talk about you actually being tagged with a depression disorder or a psychiatric disorder? So I would certainly say that have a discussion with your provider, or find a provider and then have the discussion with. It could be a primary care provider, it could be a mental health or a psychiatric provider, and then let them go through the thorough assessment, because you having the flaring or the exacerbation of mood. Let's say in Ghana society, we talk about, oh, this person has a very hot temper. That could be a manifestation of a medical abnormality that you don't know of because you've never been tested for. It could be an indication that you have a psychiatric disorder that has not been diagnosed. But the only way to definitely know is to go through that full assessment, and that full clinical assessment is very, very helpful.
Wow. Interesting. I don't know what else to really say, but I feel that we have been blessed this afternoon. Dr. Deborah, before we go, what will be your final comment to Ghanaians and to every young person, our parents listening to us? What would be your advice to them?
So it's my comments is actually a plea to our Ghanaian community as opposed to an advice. You will be surprised the number of times that you hear from someone who was raised in Ghana or any other country, especially our African countries, and then they tell you, oh, I've seen enough hardships in my life. There's no way I can be depressed in America. And I want to plead with you that that is certainly not the way to go about it. You can be living the best life you've ever lived and still suffer from anxiety disorder and still suffer from depression disorder. As a matter of fact, there are so many people who are suffering from depression that are very functional. So that is why I said the full assessment plays a major role in knowing what is going on. And so I would just plead with our Ghanaian community or our African community and our listeners that reach out. Nobody is going to put a stigma on you. Reach out to a provider, reach out to a qualified expert and say, hey, I've been feeling this way. How can you help me? There is help out there. Some of it you can get for free. But if you do not reach out, if you do not seek help, there's no way someone will be able to help you. And then the other comment that I have is a question that was actually asked of me by a friend of mine who said, who was talking about somebody who had committed suicide and said, if the person committed suicide a year or two ago, I would have understood it because he was going through some really difficult time. But over the past 6 months, he's been great. He's been hanging out with us. And then he just committed suicide. I can't understand. And so I explained to this colleague of mine that the research actually shows that once people who are depressed make up their mind that they are going to commit suicide, there is a higher chance that they start living more of a normal life because it's kind of they have a set plan, so they are able to do everything that you wanted them to do. So if a family member, if a friend of yours, you notice that maybe a year ago, 6 months ago, was having these severe depressive symptoms, and then all of a sudden the person has kind of snapped out of it, quote unquote, please do not use that as an excuse and say, oh, he's all cured. No, it might be an indication that the person has finally made up their mind to commit suicide. They have come up with a plan and the risk of suicide is very, very high. So if you have a friend like that, reach out to an expert and say, hey, can you help my friend? Or try to find a way to get your friend to seek an expert to help them. And I believe if we do these things with the help of God, we will be blessed and our families will be blessed. Thank you very much, Brother Daniel.
Thank you so much, Dr. Deborah. Thank you so much for educating us today this afternoon. We are so blessed for all the information that you have shared with us. And we also want to say that if you have any other information that we can really share it on Facebook to the young ones, to our parents, any material that you think that will be useful for them to really read, to help them, guide them, we'll be happy to really receive that and post it on our page for us. Thank you so much for this afternoon, and on behalf of the team, we would like to say thank you. God bless you so much. And we do hope that very soon we'll knock at your door again and you will help us, you open us so that you join us on the show again to discuss some health issues that are really affecting us in our various community. Thank you so much for today.
Thank you for having me.
Well,
Thank you.
listeners, if you have just been joining us, we were talking about dealing with depression and anxieties. And I'm really happy that today a lot of you have really heard so many things that maybe we might be going through in our various homes that we are not really aware of it. But these things normally really happen. There are so many things that is really going around us that we are not aware of it. But you know, it is good to really get information, and it is good to really get help. So whatever challenges that you are going to, if you feel you are going to depression and anxieties, please talk to your doctor. Or you can really Google any 1-800 number that you can really call them so that they can really help you with it. It is real. It is something that we are all going to in the face of this COVID-19 that we find ourselves in. So please get a help. If you are a young person going through so many emotional things, please get help. Talk to your doctors, talk to your pastors, talk to your friends about the difficulties and the challenges that you are going through. So before we leave, a wise man had really said that if you want to conquer anxiety of life, live in the moment and live in the breath. So courage does not always rot, but sometimes courage is a quiet voice at the end of the day saying, I will try again tomorrow. I will try again tomorrow. And this is the word that I leave you with. Whatever that you are going to, keep on trying it. Whatever the difficulties and the challenges, health-wise, please keep on talking to your friends about it. And we all will overcome. We'll also want to really advise each and everyone, if you have not gotten your shot for the virus, please go for your shot. And let all of us be safe. On behalf of the team, we'd like to say have a productive week. We see you again in 2 weeks. Have a good afternoon. Bye.
And you're worthy